Good morning again this is Dr. Bill Wyatt from beautiful Glen Rose, Texas, in the American Orthodontic Society. And I was going over some pictures of different cases that we had, and I hunted for years for somebody that had nearly perfect teeth but had never had any orthodontic work done at all. And I never found anybody in the States like that, except my wife has nearly perfect teeth. But anyways, one of my dental friends sent this young man to me to look at who had near perfect teeth. And I think we all ought to know what we're shooting for. So I wanted to go through this a little bit and show you what we feel like is an ideal setup, for the teeth in anybody coming along. So let's take a look here what we are going to cover. This young man has a good facial structure. I mean, the distance from the chin underneath the old nose and then right across the eyebrows up here and the forehead, and it's kind of balanced like that. If you add too much length in this area right here, the facial structure doesn't really look as good as it does if you just have it in thirds like that. So we try to, if somebody comes in with a long lower third of the face, we try to reduce it, and that's pretty hard to do. And so if you learn how to use these blocks where we bond onto the teeth, you can help bring this down. Now what is it that makes this height right here the same thing on most people who have no problem at all in here? We'll have this distance about a third of this from up above the eyebrows. I think it's somewhere along there. It doesn't have to be perfectly that way, but my feeling on this is that we have two forces here that are opposed to one another. I mean, the eruptive force of the teeth from both lower teeth and upper teeth. Let me get a picture here that'll be a little bit better. And here we've got the same thing, and the lip structure comes right down from underneath the nose, doesn't protrude out. In some cultures it'll be a lot fuller like that, and sometimes you'll have somebody that's kind of caved in a little bit up here, but it still looks nice, and that's fine. We don't all have to look exactly alike or try to make everybody look that way. And this guy has a real good set of teeth. I mean, it's really nice. And you look at it from the front now without a smile or anything, and he has that same, you just get a picture of what you're shooting for on everybody. I mean, you try to get the facial structure looking as best you can whenever you get somebody. You just want to make their facial structure look as good as possible. Now, in certain areas of the world, people are more full in the face, and so if they want to look full in the face, then that's fine with you. You just make them keep them that way and let them be full in the face. But if the person wants to look really as good as they can, you won't want too much fullness in the facial structure. So anyway, we're going to look at the way his teeth are. Now, it's not absolutely perfect. These pictures are quite old and they've got a little markings on them, but the midline, if you notice it right here, is off about that far right there. Now that can come about, and I don't worry about midlines being perfectly, because you can have a lateral that's too small and then it'll shift the midline over. As long as your cuspids are coming down into a good class 1 relationship, we want to have that. Here, the 4 anterior teeth are not perfectly aligned. One of them slipped out of place there, and the bite is a little bit deeper than it should be. And so you have to look at everybody very critical of this. The upper teeth have to lap over the lower teeth. And you notice these are lapped over very good. That keeps this structure on your cheeks from being sucked underneath here. And if you're a mouth breather, your tongue will be inside here, and if you think it doesn't have some force on it, but it certainly does, and it will expand the lower teeth out. And then the teeth don't hit too good, like your upper molar would be something like this, and your lower molar would be in and kind of come up in here and go down. Now this would be together here. And this upper molar being out here protects you from chewing this. Now as the tongue spreads the lower arch out, then this lower molar moves up and the cusp, or cusp to cusp, right in here. Now I'm a mouth breather, not a bad one, but I am bad. It is to some extent. I use one of these CPAPs and try to breathe through my nose, and I've got allergies and all this stuff that cause you to breathe that way. And my tongue stays in the lower arch most of the time. And so my teeth hit cusp to cusp. But at my age, I've ground the cusp off, but I've still got the teeth coming together right here at the same time. And I'll get my cheeks in between my teeth and chew almost regardless. So when I eat, I have to get some food over in the sides over here so that I won't bite my cheek over in the area. And this is, you can look at models and you can look at people and you can see these things that take place. And I just wanted you to look at a more or less ideal set of teeth here that this young man has. He's about in his, I think he's still in his 20s, somewhere like that. I have some stuff here on his age later. Now let's look from the side view, and you'll notice that the cuspids, these teeth look like they're kind of headed in this angle right here. All these teeth will be tapered toward the front a little bit. They have a tip in them that way. The molar back here in the back has a lot of it, and this is one of the 6 keys of occlusion that the straight wire people came up with. The buccal cusp the distal buccal cusp of the upper 6-year molar comes in contact with the mesial cusp of the lower 2nd molar, right in here. And that's one of the ideal things about it. And this young man has wisdom teeth and everything, and these teeth are tucked in. Now, if you're somebody and you're stripping teeth, look at there where the cusp doesn't come down and it just exactly right, and you're going to do a little stripping of the tooth, then take off the one that will allow this to move over and to close in that space. That's if you're running something abrasive between the teeth to reduce them in size. Now you need to know what you're doing when you're making difference in this. Let's look at the other side of the mouth now, and the same thing, and it looks really good. Now it's very difficult to have all the teeth to put them exactly like this. But what I do is get them lined up over the area, and to get them together, you put a retainer in there that allows the teeth to erupt into each other. Now I mentioned what causes this distance from the nose, under the nose, down to the chin, to be correct. These teeth are erupting toward one another, or toward the lower teeth, and the lower teeth are erupting toward the upper teeth. And if you take a tooth out down here, this tooth will come down further until it bumps something over a period of time. It doesn't know that it should stop up here. So if you lose a tooth, try to get something under it, and it'll stay at that height. So if you go to straighten it up, you have to pick that one back up again, and that's more difficult to do, and you need to put something underneath here so that the occlusion pushes the tooth back up, like that. Now these are just things you look at that run through your mind when you see some body, and after a while you have looked at so many people and you know what you need to get. Without even thinking anymore, somebody comes in, if you're on the bus or a train or airplane or something, and you see somebody right close up like that, you just analyze their mouth, and you can say who is a mouth breather, who is not a mouth breather, who has protrusive teeth, and who would have it. What could you do to this person to make their facial structure look better? You just automatically do that. Now this is good. This is almost ideal in the 6-year molars. You see they're coming in contact with the 2nd molar down here, and that's one of the keys to the occlusion. Now, the amount of overjet, that's where the tooth is sitting like this, and you've got a lower tooth that's coming up in underneath here. That's not a very good tooth, but it'll be coming in contact. Now this distance right in here, overjet and overbite, and so where it bites over and overjet is over this way, going forward in here. You need a certain amount of this distance in there to actually bite with your teeth, your front teeth. But when you slide your jaw forward, the front teeth upper and lower have to come together here, and you're going to bite something off. You don't want your teeth back in this area to touch at all. You just want these teeth up in the front to come in contact. And when you do that, the condyle back here in the back of the mouth, and you got a fossa, that the condyle comes out and moves out to here. It comes down, in other words, it drops down when you move the jaw forward. The condyle drops down or kind of touches on the prominent portion of the fossa right here, and you've got a contact here, and you'll have a contact down here in the front part of the mouth. You have to, excuse me, you have to think about these things. Now, if that person doesn't do that, that tells on the jaw joints and everything else. Now, if I take this and you don't bite straight all the time, and you're trying to chew from side to side. And these teeth kind of slide over on top and then back and forth like this. And when you do your condyle in one place, right here one side, and then when you slide the other side, the condyle moves over here, and that separates the teeth. That separates the teeth on the side. It comes away, the condyle comes over here. Now I'm chewing on the right side of the mouth, but these teeth don't touch at all over here. And you can chew this way or that way, and your teeth need to clear in here. So these are things that run through your mind when you're looking at somebody. What have I got to do to try to get this set of teeth on this person and this facial structure to look as good as possible? These are the things that I need to be thinking about. Now, I'm going to go to where, let's see. Okay, here are the upper, we're just looking straight at the upper teeth right in here. And you see, this is lined up. Nobody's teeth come in like that. I don't care who they are. They may come in, this cuspid might erupt in here, and the tongue will push it if it's got room enough, and it lines it up against the cheeks and lips in here, and the buccal over here lines up, and the cusp is the teeth line up here. Now, usually a molar, it'll come out to the side of the molar. You see over here, slightly further out. And these make a perfect arch. Now, nobody's touched this guy orthodontically. He had to swallow correctly, or this would not be that way. If you're swallowed with an infantile swallow pattern, and you swallow without biting your teeth together, you put the tongue in the wrong place, your teeth up here don't develop, the width in this area doesn't develop right. It'll be more narrow, kind of like mouth breathers. The lower jaw doesn't, it's just as wider than the upper jaw, and you get messed up. Now, I don't want to take too long showing you the good and the bad about things, but in order to really treat the person, I don't pay too much attention to the cephalometric points in here. I look at the facial structure and what is going to make this face look the best that I possibly can, and that's the leading thing in here. Let's go down to one more, and this is the lower. All right, the lower teeth, They have been crowded out. Now what made this tooth slide back into this position right here? And what it is, it's not that the teeth are too big or anything, but if we go back and we look at the depth of bite here, I mean this is down over the lower front teeth. These lower teeth are up underneath here somewhere, and if you go up with the bite, the room gets less, and so is it. The bite was too deep. In other words, you had too much overjet and overbite here, and the teeth, instead of being along here, they went up to here, and so something had to give, and the lower tooth is the weakest thing in here, so it slipped past. Now, if you had treated it and you put something where it couldn't happen, they still try to close back. Now, I never did finish a while ago talking to you about what makes this vertical dimension of the facial structure. And it's the eruption of the upper teeth into this and the eruption of the lower teeth. And they come in contact when they get enough force on them. And your teeth, it's complicated in here. When your teeth are the right height, you don't bang them together while you're talking or chewing or anything. They come to a certain point, and you'll have a little freeway in there, and you move your mouth around like that. But when you chew, most of the time you've got food between them, and they don't come all the way together. But if you bite all the way together, they should fit like this. And if you go to the side, bite over here, these teeth are going to touch, and these don't touch over here. And if I bite with the front teeth out here, you'll have force on the front teeth coming together, and back here at the back, the condyle, here's the fossa like this, and the condyle, if you move your teeth, your condyle would be somewhere in here, you see, and it'll move up to here. And that drops the teeth back here to the back side, so that nothing touches except the front teeth out here and this condyle hitting when it gets up on high here. And so you normally do not bite hard when you bite something with your front teeth. If you bite real hard, you're putting a tremendous force on this condyle, and there's a disc in between here, and your muscles are right in this area here, and they get more force back here. It's like if you bite 10 pounds of force up here, you may have 20 pounds or more. I don't know exactly, but it's a lot more because the muscles are back here, and you're pulling this jaw up with the muscles here, and it's right over about the second molar back here somewhere. And the molar teeth are the ones you chew harder on. So when I go in to chew something hard, you bite straight on. Let these teeth go out over the top, and your pressure's in here, and you take pressure up and down on the bone structure right in this area. Now, if you've got a joint problem, we put splints in people, and the thing that the splint does, you move the jaw to where it wants to go in here, and you mark it. And usually, most of these people, you will bring your lower jaw forward, and it gets the condyle may be pressing back in the back area too much, and it's impinging on the retrodiscal tissue, and the condyle is irritating this tissue, and that's what creates your problem now. So you want this condyle to move forward, and if you just move the condyle something like that, and we do that by putting a bite plate in there and have a little ramp, and the teeth hit this, they have to come, this ramp, the teeth will come on this side, and they have to go forward. Well, when you do that, it's like biting on your front teeth. The force is going to be here and here, and that won't cut it if you're having pain back here. So the splint fills in this gap so that when you're biting forward, your teeth are hitting one another, and the force is up through the bone down in here, and it's off of the condyle back there. Now, you think about all these things when you're looking at somebody. This is important. People don't realize how the teeth work, and you look at how they should work. Now, I wish I could. Everybody that works on teeth or works as a dentist or helps that ought to understand something about orthodontics. It is ridiculous the mistakes we made in diagnosis and everything simply because we don't know it. If we should teach more orthodontics to everybody that works on the teeth. If you want to do it right. But you know what can be done, then send it to somebody else that does it. And if you want to do some of it, you can just try to get to do the simplest thing possible, and don't make it feel like a criminal because you're straightening teeth. I mean, that is ridiculous. So I've been preaching on that for a long time. All right, let me continue on here. These teeth are lined up like that, and down on the bottom, because these teeth look like they're too big, the only thing wrong is that they are too far up. In other words, the amount of overjet and overbite is too great here. It should be here and here. And so when you straighten somebody's teeth up and they've got a deep bite, we put a bite plate in here and hold that at a certain distance for a long time until if the person gets used to it, or the whole thing, the pressure of the occlusion from the bottom to the top, work it out in there. Now, what causes some people's teeth to just be too full for the mouth? Now time is running on here, but but I can show you. The upper teeth come to right here. I mean the edge of the upper teeth. The edge of the lower teeth come up here. That is too much for this person. So these teeth look crowded down here. If you go back there and look at them, this tooth is crowded out. And if you looked at it, it goes up higher most of the time because it doesn't hit right at the surface in here. And so that's the one thing that's wrong with this guy's teeth. They're not bad, but this doesn't bother the person much. If you got just a little bit of this, you can strip these teeth a little and let this tooth slide back into place, even though it's further up than it ought to be. In other words, if you could open it up where it hits here, there's that much more room in the teeth to stay. So you can take somebody that looks crowded, just all get out, and you open their bite, and it fits good. The teeth fit. Now, there's people who have that are in the mixed people in the United States, say for instance, or any developed country like that. You have people that have broad faces and they have broad teeth and they fit together good. And you'll have somebody else that marries somebody with a thin face and smaller teeth. And if the child gets the tooth of the bigger person, those teeth will not fit in that person's mouth. You could put them in there if somebody wants them, but you're going to be protrusive and stick out. And so people said, oh, they don't want to take any teeth out, so they have to back all these teeth up back here and pull out the wisdom teeth and say, well, they didn't extract, they just took wisdom teeth and they're no good anyway. Literally, the wisdom tooth is the best chewing tooth you got in your mouth if you got room for it. And they made me take mine out before I started the dental school. I mean, that was about as stupid as thing that they could do. If you had room for them, you need them. And they're the best chewing teeth in there. So, there's just a lot to learn about the teeth. And I think every dentist, everybody that's trained in this field should be trained and shown what can be done orthodontically with that. Now the thing that makes this dimension in here, these teeth erupt down and these come up, and you're biting and chewing and clenching and whatever you do, pushing on there, and the amount of pressure that you put together from the muscles in here counteracts the erupting force of the teeth, and that's what makes this dimension in here. So if you change this dimension, you need to change the amount of teeth that you put into place and everything here, so that this is balanced out, and that's where your vertical height of the face will go to. Well, I've talked probably too long here, and I wanted to show you this case. This young man was 26 years old, and this was 1973, and that was I got him in. There's not too many people have their wisdom teeth. Here's the wisdom tooth, the second molar, the first molar. The first molar will come in contact with the second molar back here, and that's one of the 6 keys of occlusion. The overjet and overbite is too much on this, so the lower teeth are the weakest ones, so they crowd it out here. If that doesn't crowd out, the upper teeth have to separate some. So we got a little separation in here, so you got a little bit of both sides. Now this guy's got good bone structure, and you can do something to the crown all through you. The teeth are amazingly hard. Like these front teeth here, they're about 88 years old right here. And I've chewed things on them, and there's very little wear as far as the edge of the teeth is concerned. You have good hard enamel. So I thank you for watching these videos. I want to enlighten everybody wherever you are in the world. I don't have any double-blind studies here to this. This is just what I come up with my own thinking about this. But there's very little that is wrong that I can think of about it. And I want you to do good orthodontic work, regardless of where you are. And if you don't understand, you can go back and take these videos and work them and see them over and over and over again until you know just what I did. Now I use a 018 slot bracket, and I use it on the molar back here. I use this is the molar. We put the bands a little bit lower on the lowers, or get the bracket a little lower so your upper cuffs don't hit the bracket right there. And we put a double tube. We have a tube for your arch wire. Well, there's one tube, the arch wire's in the middle. This one is for lip bumpers or intruding arches, and then you've got one here for headgear. So the lower 6-year molar, we got 3 attachments on the side. The other side you have a button so you can wear elastics and you can move the jaws one way or another in relation to each other. So I thank you for watching, and I hope that each of you will really get out and learn what you need to do if you're going to do this work on people. Learn something about it, or do it real simple. If you're out there and nobody to help, learn how to put the bracket in the right place. You really need some assistance in doing that. But you may not have it, and you maybe can figure this thing out yourself. So I'm going to say goodbye, and for the time being. And here is a guy. See, this went up too far. Now this is a cephalometric, and this is the fossa is somewhere up in here. I can't hardly see the turn, but the facial structure is lined up good. And you can have some people will be on out here, and that's where all of them look. So that's fine. And if somebody wants to be full, or somebody that is full wants to be straighter, you can extract some teeth in the bicuspids and bring the teeth back. Thank you for watching, and I'm going to close up now and say goodbye, and